Today, let's look at stretching for low back pain. Do you need to stretch for low back pain? Does stretching actually prevent low back pain? Have you been told you need to stretch your hip flexors, your psoas, your QL, and then strengthen other very specific muscles? Sometimes these things may have some effect on your pain, and sometimes, and spoiler alert, more often than not, you might just be wasting your time spinning your wheels doing a bunch of things that are basically useless. Let's try to sort out the difference. When could stretching possibly matter? When does stretching just waste your time when you could be doing better, more important things? And before we dive into it, I really want to emphasize, I am a huge believer in doing the 20% of things, the fundamentals, doing them really well. Because with the 20% of things, the basics, you're gonna get 80% of the results. But most rehab is backwards. You focus on the 80% of bullshit, you get confused, you get so bogged down in the weeds, you focus on the 80% of bullshit that gets 20% of the results instead. So let's try to sort that out, make your path for rehab for low back pain and sciatica a little bit simpler. So today we'll talk about what causes low back pain, what actually causes low back pain and sciatica. Does flexibility matter? We'll talk, I am so sorry. I forgot to include the actual research on this, but I'll try to make sure that I touch on this in the video anyway, is stretching before exercise. Do you need to do it? And then what to do instead, So let's dive into it. Does stretching prevent low back pain? Okay, first of all, how does injury actually happen? How does pain happen is really the question, okay? Why does low back pain and sciatica actually happen? Most people think you have an injury, you slip and fall, something is damaged, something is wrong with your spine, you have a disc herniation, you tore a muscle, you tore a ligament, you have a sprain or a strain. There must be something wrong. Maybe it's out of place. By the way, I have a whole video on do joints go out of alignment, and spoiler alert, they do not. But I explain it very thoroughly in that video, so be sure to check that out. Most people think that you have pain, that means that something is damaged in your body. That's it. That's all we think about. And even doctors, chiropractors, physical therapists, we are subject to that type of thinking. We are really tunnel visioned and we think, oh, well, you have pain, we gotta fix the thing that's on the MRI, we gotta fix the alignment, otherwise you're gonna have pain forever. And guess what? That's bullshit. That's not how pain actually happens. Here's what actually causes pain. And by the way, in all of my slides, please pay attention to this bottom area here where I have references. I am not making this up. I am not giving you my opinions. These are research-backed facts, all right? This is science. I'm just sharing the research with you. I just am putting some pretty pictures so that research isn't so fucking boring. So let's dive into it. What actually causes pain? Well, let's look at the cup analogy. You've got a cup. The cup fills up with too much stuff. If it overflows, you get pain, or maybe you get sick, or maybe you get an illness, or you get a disease, or something. Something has to give because your body cannot take all of the stuff that it is trying to handle at a given time. Now, here's where most people go wrong. This makes sense, but you're usually thinking physical stuff. I'm overtraining, I'm doing my exercises wrong, I have bad technique, I have bad alignment, those types of things. Maybe those things have, yeah, sure, that could be a drop in the bucket, but also, fear of pain is a huge thing that contributes to filling up your cup. Overtraining is definitely part of it for some people. Poor sleep can be part of it. Stress can be part of it. Mental and emotional stress. Junk food, crappy environment, heavy metals. You name it, anything could be in your cup. You got to figure out what's in your cup. Take shit out of the cup and then build a bigger cup. You need a bigger cup, right? So how big is your cup? Well, if we can do strength training and teach you good stress management strategies so that you can handle more stuff without the cup overflowing, then you are not going to have as high a risk of having pain or injury or sickness or illness or any ill health effect in the future. One last time, I just want to point out, I always have my references at the bottom of the slide. This is not my opinion. This is backed by research. I'm just sharing the research. Okay, so That said, when we look at pain, we cannot reduce it to flexibility, right? So even if flexibility is helpful sometimes, we cannot simply boil down a complex issue like pain to, well, your hamstrings aren't flexible. That's it. Just get stretchier hamstrings and you're going to magically cure your chronic low back pain that you've had for 5 or 10 years. Get real, right? So that said, keep that in mind while we talk about flexibility, that even if flexibility has an impact, it's not the whole picture. So, does it have an impact? Well, here are some studies that basically show that for some populations, basically group sports, we look at things like golf and hockey and soccer, group sports. When we see that, we see there is some correlation, okay? It's not nothing. Flexibility, it's not that it doesn't matter at all. We do have sort of a weak predictive value for low back pain for people who are a little tighter. However, and I didn't cite the studies here, but if you want them, I can share them. We do see that for some populations, this is really interesting, is you see that within a population, people who are really inflexible, they're really tight, they are more at a slightly higher risk of injury. But then on the other end of the spectrum, same exact group of people, same exact demands from their sport, that the people who are too flexible, hypermobile, also are at a higher risk of injury. So does stretching help with low back pain? Maybe if you're really inflexible compared to your peers and relative to the activity or sport that you might want to be doing, then maybe, right? So, and again, this matters, it depends on the sport. So if you look at things like running, right? Well, a marathon runner needs to be tight. They are a more efficient runner if their hamstrings are tight, and they are at a lower risk of injury by being tight, right? Meanwhile, a sprinter might be at a higher risk of injury if they are too tight, right? So a marathon runner needs to be tight, sprinter needs to have hamstring flexibility, hurdler really needs to have some flexibility, you know what I mean? So it depends on what you actually need to do as far as your injury risk, and keep in mind here we're talking about sports, and sports are a sort of a unique weird ecosystem when it comes to the research. So now let's talk about general population. So yes, for some people, sometimes flexibility matters. However, when we look at the general population, we look at, office workers, desk workers, your average Joe, your average Jane, your average person. We look at factory workers, we look at people who are just, average blue collar jobs or, IT jobs, whatever. Those types of things, we see that flexibility does not predict pain for those people. There is no correlation. So you could be tight, you could be not tight, it doesn't seem to have a huge impact. So don't worry. For most people, you probably don't need to worry about flexibility actually impacting your pain. And then I have this one because there's also a couple of studies in here that are looking at children, and actually it's the last study right here. And they're looking at, does being flexible as a kid make it less likely that later in your life you're going to have low back pain? And we find that no, that doesn't seem to be a predictor. So again, flexibility for the average person, stretching does not really make a big difference, okay? I'm gonna quickly pause. I don't have a slide on this. I'm sorry, I forgot to include a slide on this, but I could share the research with you if you want. I'm happy to cite my sources. But as far as stretching before exercise, there's plenty of research on this, and we find that static stretching, there's different types of stretching. This is an important caveat. There's static stretching, there's dynamic stretching where you're moving while you're stretching, right? Then there's passive stretching where you're just relaxing, and there's active stretching where you're contracting muscles, okay? Long story short, static passive stretching does not reduce injury risk at all as a warm-up or a cool down for exercise. So you absolutely do not ever need to do a static stretch for low back, for any kind of injury prevention. Static stretching is basically useless as a way to prevent injuries. Sometimes static stretching is useful for certain applications, for certain outcomes, but not to prevent injuries as a warm-up or a cool down. However, and again, I'm happy to cite my sources on this. I can pull up tons of studies on this, and I'm sorry I didn't make a slide. But you can also find that dynamic stretching, which is really just movement, right? It's like high knees and butt kicks and karaoke's and like a walking hip flexor stretch, that kind of stuff where you're just moving. I mean, I guess technically you're stretching, but really it's just like a bodyweight warm-up. That stuff actually is useful as a warm-up. So you could call it stretching, and it is dynamic stretching, but at a certain point, it's really just bodyweight exercise. Bodyweight exercise is important to prevent injuries and reduce your chance of injury. Okay, now, so we were, just to back up, right? So we found, so for certain populations, flexibility might be a little bit helpful in sports. For the general population and most people, you don't really see that flexibility has any correlation with low back pain, so stretching really doesn't seem to be important to prevent low back pain. And then we find studies where hypermobility, you have too much mobility, we find that hypermobility makes things worse. Right? So, and there are a bunch of studies on this where we find that people who are extra flexible. I work with a lot of yoga people. I teach yoga, so I'm around yoga people all the time. A lot of my patients locally, they are yoga practitioners, and they're hypermobile, and they have chronic pain. They just got aches and pains all over in all their joints and their muscles, and they're stressed out, and they don't know what to do about it. And so they stretch. They go to stretching as their go-to, and it doesn't work. Either it gives you temporary pain relief, but not a long-term solution, or it sometimes just makes things worse because you're already too fucking flexible. So what do you think that these people need? They probably need more strength and stability. And this was a huge statistic right here. The first study right here showed that you had a 50% higher chance of experiencing low back pain if you were hypermobile compared to your peers that were not hypermobile. And the rest of the studies here looking at many different populations. So we see this across different age ranges and different types of population and different genders. And we see that in general, hypermobility is a risk factor for pain. I'll explore this in another episode. There is stuff that you can do to offset the risk. If you're hypermobile, don't worry, don't freak out, don't panic. There is absolutely a solution, but I'm going to have to explain it in another episode if you really want the full solution. So what do you do instead? What do you do instead? You get strong. So I cited, 3 different studies here on resistance training and looking at posterior chain exercises. That's like your hamstrings and glutes and that kind of stuff. I could have gone on all day citing study after study after study after study that basically show that exercise is so fucking good for low back pain and sciatica, especially for the long-term solutions. Now here's the trick. A lot of people, you try to get into exercise with low back pain and sciatica, you do too much and you don't get better, it hurts, you have these barriers to exercise. You want to exercise, but every time you try it, you have a flare-up. So it's really important to not do too little and not do too much and have some guidance around it. This is where some of the, manual therapies, massage, acupuncture, chiropractic, all that stuff, although that stuff is not a good long-term solution, it does usually provide temporary pain relief. So sometimes it's useful to do some like self-massage, we're talking about stretching. I mean, look, stretching, although it doesn't do anything for you long-term, but if stretching provides you some temporary pain relief and you can do a couple of stretches before you do exercise and you just feel better when you exercise, cool. That's awesome. Now you're more likely to actually do the exercises that are going to get you strong long-term, so you can actually do the long-term solution, right? So although we found that in general, stretching and flexibility is pretty much useless long-term to prevent low back pain, when we look at it in the moment, if exercise is too painful to even do, then do some stretching if it feels good. That's fine. Get a Theragun and do the massage gun if that feels good. Do the foam rolling. Get a lacrosse ball. I don't care. Pick your poison. Pick whatever tool you like that feels good. Get a foam roller. I don't care. Whatever feels good so you can actually do the exercise. The exercise is the long-term solution. So whatever gets you to do that is a very good thing in my mind. And by the way, if you're watching live, I'd love to hear from you in the chat, and just let me know, like, have you tried to get into strength training, and maybe are you nervous about strength training or picking up weights? Like here, I pictured people with weights. Are you afraid of doing that because you're going to get injured? If so, that's a totally legit experience, and a lot of people have that fear. And I've got tons of videos on the fear of pain and how fear of pain is more disabling than pain itself. But the short answer here is that if we can ease into a little bit of exercise at a time, start with easy stuff, then slowly work our way up over time, build confidence, you're going to have a much, much, much better time. And this is, again, exercise wins every single time. Stretching, not super useful. Strengthening, very useful. And it's not just about pain, right? It's about disability. Can you actually do the functions that you need to do and get back to normal life? It's about quality of life. We saw in some of these studies, we saw a better self-efficacy, right? So your ability to take care of yourself rather than needing to reach out to somebody like me for help all the time. Although here's the balanced view of that, right? So self-efficacy is really hard when you're trying to do it all on your own at the start, because we see the biggest challenge for people is that when you're just getting started and you really don't know what to do, and there's a lot of conflicting information on the internet. Oh, and by the way, let's just remind you that every single one of my slides when I'm talking about this stuff, I'm citing my sources. But the biggest challenge that I see, and this is experiential, is that patients have a really hard time with the rule of twos. If you do too little for too long, you don't get better because you don't get stronger. And you're more likely to have an injury because you're just weak. Your body can't handle difficult stuff. So you go to try to lift a couch and you haven't lifted a weight for 5 years, you try to move a couch, you're just more likely to get injured because you're weak, you know? The opposite is also true. You do too much too soon and you're more likely to get injured because you're pushing it too fast. So whether you undertrain and you baby it and then you don't get stronger, right? You're probably not going to fix your pain. And if you go too fast and push it too fast and overtrain and don't recover and don't get good sleep and don't give yourself days off, days for rest and recovery, then you're also likely to get injured. So the point here is that the biggest challenge that I see when we're trying to implement this strategy of, okay, cool, get strong, awesome, all right, I'm convinced, let's go pick up weights, let's go to the gym, whatever, cool, maybe you're excited about it, but hold on, because it's a real fine balance of like, we don't want to do too little because then you don't get stronger, and we don't want to do too much because then you get injured, right? So what is that middle ground? What is that middle path? And this is where it's really helpful. I was talking a second ago about strength training and the fact that you need, that when people do strength training, they develop self-efficacy, the ability to take care of themselves without needing outside help. However, how did they get there in the first place? They had guidance, right? They had somebody like me to show you, all right, this is for you, this exercise is way too easy. You could just do this forever and you're never gonna get stronger. But this exercise is too hard, right? So let's drink the porridge that's just right. You know, that's the key, is to have somebody on your side to teach you the way so that you can become self-reliant. Right? That's why I created a program, right? I mean, I do have a program for people with low back pain and sciatica. It's called the Beyond Back Pain 12-Week Rapid Healing Intensive. I'm not going to ramp about it, but just so you know, I put together people's exercise programs so you never have to worry if you're doing too little or too much. You get unlimited chat support, so when you go to do an exercise and it feels weird, you can chat with me anytime. You get an educational course just like this, citing all my sources, teaching you myth from fact, health from hoax, so you actually understand the science of pain, and you get group coaching so that you get accountability and community, and then you can get your questions answered. So just know that you can always book a Beyond Back Pain discovery call with me. I take these calls myself. I give you an hour of my time, and I answer all your questions and get you some clarity around what you're dealing with, what you've tried, why what you've been doing hasn't worked in the past, and what you need to do to move forward. So if you ever want that, just go watch the masterclass below. There's a link. Just go watch the masterclass. If the way that I approach healthcare in general, if you resonate with that and you like the fact that everything that I'm talking about is research-based, then you can always book a call with me after that. But let's recap. Let's sum things up. So the point here is, when it comes to stretching and low back pain, can you prevent low back pain by stretching? Well, okay, so flexibility might might help a little bit for some people sometimes. That was more for group sports, team sports. Most people, the general population, do not need to worry about flexibility. You're wasting your time doing the 80% of things that get 20% of the results. I want you to flip the script. I want you to simplify your rehab life and do the 20% of things that gets 80% of the results, right? And that is the basics. Focus on the basics. It's not glamorous. It's not sexy. It's not a bunch of fancy corrective exercises like you're going to see on Instagram, but I'm telling you, the fundamentals are the best way to do it. And by the way, with stretching, remember, hypermobility, extra flexibility, is a risk factor for additional pain. So in that case, it's really much better to just focus on strength and stability, right? You get stronger over time, your body is physically stronger and more capable of handling the stresses that life throws at it. You're less likely to get injured. You're more likely to develop a long-term strategy where you can take care of yourself. All around, strength training is just a much better option. So if you have questions, leave them in the comments. Thank you so much for watching. If you join me live, hey, I'm gonna hang out for just a couple of minutes if you do wanna ask any questions, but thank you so much for watching. I will see you in the next episode.